Welcome to the deep dive. Ever wondered about those unexpected lumps and bumps that can sometimes show up in our pets?
Yeah, they can be worrying.
Exactly.
Yeah.
So today, we're zoning in on a specific type, these non-cancerous growths called polyps. We're looking at ones in the nasal passages and also the area connecting the back of the nose to the throat, the nasopharynx.
And we'll be focusing primarily on dogs and cats here.
Right. We've got an informational excerpt to guide us, covering the basics, really, what they are, who gets them, the signs, causes, diagnosis, treatment, the whole picture.
Basically giving you the rundown.
Our mission, if you will, is to unpack all that. We want you to get a really clear understanding of what these polyps are, how they might, manifest in your own animals, and what vets look for and do.
Yeah, what the process actually involves.
So let's dive in. When we talk about these polyps, nasal and nasopharyngeal, what are we actually looking at? What are they?
Okay, so simply put, they're growths, but not cancerous ones. They stem from inflammation.
Inflammation.
Yeah, they come from the lining inside the nose or that nasopharynx area, and they usually have like a stalk, kind of like a little mushroom.
Ah, okay. And you mentioned nasal and nasopharyngeal, so there's a difference there.
Definitely. Nasal polyps, they're actually not that common. They start inside the nasal passages themselves in those sort of scroll-like bones, the turbinates.
Right, the ones that warm the air.
Exactly.
Yeah.
And in dogs and cats, these are pretty much always inflammatory.
Okay. Inflammatory, not too common, inside the nose. Got it. What about the nasopharyngeal ones then?
Now, these are relatively common, especially in cats. They actually originate usually from the lining of the middle ear or the base of the eustachian tube.
The middle ear, that's interesting.
It is. And, if they grow out towards the throat area, that nasopharynx, we call them nasopharyngeal polyps.
Right.
But if they grow the other way, into the ear canal, then they get different names like middle ear polyps, oral polyps, sometimes just benign inflammatory polyps.
So same kind of growth, different name depending on where it ends up. Makes sense.
And that location is really key for the signs you might see.
Right. So who tends to get these? Is it like specific breeds or ages?
Well, the source suggests a bit of a pattern. For the nasal polyps, it tends to be middle-aged to older dogs and cats.
Okay, so maybe less likely in a really young pup or kitten with a stuffy nose.
For the nasal ones, generally yes, but when you look at the nasopharyngeal polyps, it flips.
Oh.
Yeah, those are actually much more common in kittens and young adult cats. I mean, the age range is wide, months up to 15 years, reportedly, but definitely skewed younger.
Wow, okay.
And interestingly, they're pretty rare in dogs.
So that age difference is a big clue, isn't it? It suggests maybe different causes or triggers at play.
It really does, yeah. It points towards potentially different mechanisms behind why they developed. Definitely an area for more research.
Okay, that's really helpful. Young cat, maybe think nasopharyngeal. Older dog, nasal polyps might be, higher on the list. So let's talk signs. What should pet owners be watching for? Let's start with nasal polyps.
Right. With nasal polyps, the signs are usually chronic, meaning they've been going on for a while. Think persistent nasal discharge, maybe thick with mucus, or even pus-like.
Okay, that sounds unpleasant.
Yeah. And noisy breathing, too, specifically a sound called stertor. It's that sort of snorting, rattling sound from the upper airways.
Like they're really congested.
Exactly. So congestion, discharge, maybe sneezing fits, sometimes even nosebleeds, epistaxis.
Epistaxis, right?
And often a really key thing is that the airflow is reduced, but usually just through one nostril. It tends to be unilateral.
One-sided. And you mentioned chronic. Does that mean antibiotics usually don't help much?
That's often the case, yeah. If you've tried antibiotics and the signs just aren't clearing up, that might make you suspect something more structural like a polyp instead of just a simple infection.
Okay, so chronic, one-sided, gunky nose, noisy breathing, doesn't respond to meds. Good indicators. Now, what if the polyp is nasopharyngeal, or maybe going into the ear? What changes?
The signs there can be, well, quite a bit more varied. It really shows how they can press on or affect nearby structures.
Okay.
You might get noisy breathing again, but often it's high-pitched and happens when they breathe in. That's called inspiratory stridor.
Oh, pat-pitched, okay.
You might also see gagging or even a bluish tinge to the gums or tongue. That's cyanosis, lack of oxygen.
That sounds serious.
It can be. Also, maybe a change in their voice, their meow or bark. difficulty swallowing, which is dysphagia.
Dysphagia, right.
And if the ear's involved, you could see those really stubborn ear infections that just don't respond to treatment, chronic otitis.
Otitis, the ear infection.
Yeah. And because it's all happening up in the head near important nerves, you can even see neurological signs.
Yeah.
Things like a head tilt or rapid involuntary eye movements, that's nystagmus.
That's nystagmus, eh?
Or even uncoordinated movement, ataxia.
Wow, quite a range.
Yeah.
The source also mentioned Horner's syndrome. Could you remind us what that looks like?
Yeah, Horner's is a specific set of signs on one side of the face, usually a droopy eyelid, the pupil on that side gets smaller, sometimes the eye looks a bit sunken, that kind of thing.
Okay, so the fact that these polyps, especially the nasopharyngeal ones, can cause all these different signs really highlights how much they can impact things nearby.
Absolutely. It really paints a picture of the anatomy there.
So what actually causes these things? Do we know why they start growing?
Well, that's the frustrating part. The exact cause isn't really known.
Still a mystery.
Pretty much. The source suggests possibilities like maybe it's congenital, something they're born with, or maybe it's the body's sort of over-the-top response to long-term inflammation.
So inflammation keeps coming up.
It does. But yeah, that uncertainty, it just shows it's kind of complex and we don't have all the answers yet.
Which makes prevention tough, I imagine.
Exactly. It really puts the focus on figuring it out once the signs appear.
Okay, so if a vet suspects polyps, how do they actually confirm it? What's the diagnostic journey like?
It's usually a multi-step process. First, they have to rule out other things that could look similar. You know, the differential diagnosis.
Like what kind of things?
Well, in cats, simple upper respiratory infections are common, right? So you consider that.
Yeah.
Or maybe the nasopharynx itself is narrowed. That's nasopharyngeal stenosis.
Okay.
Or chronic ear infections, like we mentioned, could even be a foreign object stuck somewhere like a grass seed or something.
Happens all the time.
Yeah. And sometimes paralysis of the voice box, laryngeal paralysis, can cause funny breathing sounds. And crucially, you have to rule out cancer.
Right, that's always a concern.
Definitely. Various types of cancer can occur in the nose, nasopharynx, or larynx. So the vet has to be thorough, consider all these possibilities.
Sounds like putting puzzle pieces together.
Yeah.
What about basic tests, like blood work or urine tests?
No.
Do they help?
Generally, your standard CBC, chemistry panel, urinalysis, they're good for checking the pet's overall health, maybe looking for signs of infection or inflammation generally, but they don't specifically point to polyps themselves.
Okay, so more of a baseline health check. Any other specific lab tests?
The source mentions screening for feline retroviruses, FeLV and FIV.
Leukemia and AIDS viruses in cats.
Right. That might be done as part of a bigger workup, especially in cats, given they're more prone to the nasopharyngeal type.
Makes sense. Okay, what about looking inside? Can you see these on x-rays?
Sometimes. Skull x-rays might show a sort of shadowy mass, a soft tissue density in the nasal area or the nasopharynx, or maybe in the middle ear structure, the bulla, or even the ear canal.
But, a sense of but.
Yeah, there's a pretty significant but. X-rays have about a 25% false negative rate for these.
Meaning a quarter of the time the polyp is there, but the x-ray doesn't show it.
Exactly. So, X-rays might be a starting point, maybe because they're more readily available or less expensive, but you can't rely on them alone.
Okay, so they might miss things. What's better then? Advanced imaging.
Definitely. CT scans and MRI are much, much better for spotting masses in these tricky areas. Nasal passages, nasopharynx, the ear.
They give a more detailed view.
Way more detailed. Their higher sensitivity is really key for an accurate diagnosis and also figuring out exactly where the polyp is and how far it extends.
Which is probably important for planning treatment, right?
Absolutely vital.
So imaging helps see it. Are there ways to, directly look?
Yes, direct examination, usually under general anesthesia, is often needed.
Okay.
This could involve the vet actually feeling the soft palate area, carefully looking into the back of the throat, the nasopharynx, the larynx, using special lights and instruments.
Sounds thorough. What about using scopes? Endoscopy.
Yep, endoscopy is super important here. You can use flexible scopes, fiber optic ones slid gently up the nose to see the back parts. That's caudal rhinoscopy.
Caudal meaning towards the tail, the back.
Right. And then rigid scopes can be used to look at the front part of the nasal passages, rostral rhinoscopy.
Rostral towards the nose.
Exactly. And of course, a really good look in the ears with an otoscope is crucial, especially if you suspect ear involvement or those nasopharyngeal polyps originating from the middle ear.
Okay, lots of ways to visualize, but how do you know for sure it's a benign polyp and not, something worse like cancer?
That comes down to getting a sample. collecting tissue either with a fine needle called an aspirate or taking a small piece, a biopsy.
Okay, getting some cells.
Yeah. And then examining those cells under the microscope, that's cytology and histopathology. That's really the gold standard for confirming it's a benign inflammatory polyp and ruling out other nasty things.
Right, got to look at the cells themselves. Okay, so let's say the diagnosis is confirmed, nasal or nasopharyngeal polyp. What's the plan? How are they treated?
The main treatment, really the cornerstone, is surgery, surgical removal.
Just take it out.
Basically, yes. But the key, the source stresses, is complete removal. You have to get the whole polyp, including its stalk or base where it's attached. That's absolutely critical to stop it from just growing back.
Recurrence is a risk then.
It definitely is if removal isn't complete.
And does the surgery differ depending on where the polyp is? Nasal versus nasopharyngeal.
It does. For nasal polyps, since they're inside the nasal passages, the surgeon usually needs to make an incision into the nose itself. That's called a rhinotomy, or sometimes it might be removed as part of a larger biopsy procedure.
Okay, rhinotomy for nasal ones. What about the nasopharyngeal kind?
For those, there are a couple of main approaches. Sometimes, if it's accessible, the vet can actually grasp it and gently pull it out through the mouth. That's called traction removal.
Sounds simple.
It can be, but it might not get the whole base, especially if it originates deep in the middle ear. So a more involved surgery, called a ventral bulla osteotomy, might be needed.
Ventral bulla osteotomy. Break that down.
Okay, ventral means from the underside. Bulla refers to the tympanic bulla, that bony bubble enclosing the middle ear. And osteotomy means cutting into bone.
Ah, so opening up that middle ear structure from underneath.
Precisely. This gives the surgeon direct access to remove the polyp stalk and the affected lining inside the middle ear, where these polyps often start. It really helps reduce the chance of it coming back.
That sounds much more invasive than just pulling it.
It is, but often necessary for a complete cure. Surgery through the mouth, the oral cavity, is also a common way to access and remove these nasopharyngeal ones, sometimes combined with the bulla osteotomy if needed.
And the sorts mentioned doing that bulla osteotomy at the same time sometimes.
Yeah, it's recommended if there's obvious evidence that the middle ear is involved based on imaging or examination. Doing it concurrently helps ensure you get the whole root of the problem.
Right, address it all at once. So surgery is key. What about medications? Do they play a role?
They're more supportive, really. Antibiotics might be used if there's a secondary bacterial infection going on in the nose or ears.
Makes sense.
And interestingly, the source mentions using anti-inflammatory steroids, like corticosteroids sometimes. Specifically, maybe a course after the traction removal method for nasopharyngeal polyps.
Why then?
The thinking is it might help reduce any leftover inflammation and maybe decrease the chance of recurrence. It kind of highlights that underlying inflammatory nature of these polyps again.
Okay, so tackling the inflammation post-surgery. Got it. So after the surgery, what happens? What's the follow-up like? And are there potential, side effects or complications?
Well, like we mentioned, recurrence is possible if the removal wasn't totally complete. That's the main long-term concern.
Okay.
As for immediate post-op things, the source points out a few possibilities. Horner syndrome, those eye and face signs we talked about, can happen.
After the surgery.
Yeah, either temporarily or sometimes permanently, unfortunately. It can occur after both the simple traction removal and the more involved bulla osteotomy. It's because the nerves controlling those functions run right through that area.
Delicate neighborhood.
Very. Also, particularly after the bulla osteotomy, pets might develop temporary facial weakness or paralysis or some balance issues, vestibular syndrome, usually temporary, but something owners need to be aware of.
That could definitely be alarming to see right after surgery.
Absolutely. It's really important for vets to discuss these potential risks beforehand so owners aren't caught completely by surprise. But the good news is, if they manage to get complete surgical removal, the overall prognosis is actually excellent.
That's great to hear. A good chance of a full recovery if done right.
Exactly.
Okay, so let's quickly recap this deep dive then. Nasal and nasopharyngeal polyps, they're not cancer, but they are inflammatory growths. They can cause a whole range of signs, some quite serious, especially in cats, it seems.
Right. From stuffy noses and breathing issues to ear problems and even neurological signs.
And figuring them out often takes more than just a basic exam. You might need advanced imaging like CT, maybe endoscopy, and definitely getting a tissue sample is key.
Diagnosis needs that confirmation.
And the main treatment is surgery. Getting the whole polyp out, base and all, is crucial for preventing recurrence. even if it sometimes requires a more complex procedure, like that bulla osteotomy.
And while there are potential side effects from surgery, like Horner's or balance issues, the outcome is generally really positive with complete removal.
A good reminder that even non-cancerous things can cause significant trouble, but are often very treatable.
Well put.
So that brings us to our final thought. We've talked about how the exact cause is still a bit fuzzy, linked to inflammation perhaps, and recurrence can happen. So here's something for you to think about. What kind of future research, or maybe veterinary advancements, might one day help us actually prevent these inflammatory polyps from developing in the first place? Could we tackle that underlying inflammation earlier, or understand the triggers better to give our pets even better well-being?
That's a great question to ponder. Where could preventative medicine go in this area?
Exactly. Something to think about. Thanks for joining us for this deep dive.